Hi, I'm talking about chapter 24, symptoms and signs, describing problems. The problems which patients report to the doctors are called symptoms, for example, pain or nausea. Signs are what the doctor thinks, also known as findings on examiner the patients. For example, high blood pressure or a rapid pulse rate. Symptoms are also known as complaints. To report a patient's symptoms or complaints, doctors say, Mr. Farswood has admitted complaint of chest pain. I case note the abbreviations CO is used. Chest pain. B. Presentations. Patients say they went to the doctor. Doctor says the patient presents the symptoms, which in case a patient to visit a doctor or the two presents is called the presenting symptoms, presenting complaint, or presentations. High presentation symptoms was chest pain. High's presentation complaint was chest pain. He presentation to his GP with chest pain. The usual presentation is chest pain. C. Talking about symptoms. Symptoms. Tiredness, lethargy, fatigue, lassitude, loss of energy. I feel tired all the time. I feel completely wore out. Lately I be feeling completely exhausted at the end of the day. Malaise, general feeling of being unwell. I feel unwell. I don't feel well. I be feeling off color for 2 days. I have been feeling myself for a week. I been out of sorts all day. Anorexia, loss of appetite. My appetite is very poor. I've been off my food for days. Weight gain, increase in weight. I be put on 80 kilos in the last year. I be gaining 5 kilos. Weight loss, decrease in weight. I am not eating any less than usual, but I be lost a lot of weight recently. Constipation, hair infrequently faces. My emotions are very hard. I be cute, constipated early or lately. I am not very regular. And chapter 25, blood. A. Full blood count. El capítulo 14 sobre los síntomas y signos. En la parte A, la descripción de los problemas. El problema que los pacientes le reportan o le describen a los médicos cuando lo llaman síntomas. Por ejemplo, el dolor o la náusea es un signo. Pero cuando el doctor Pero cuando el doctor, además de un síntoma, también lo examina y el paciente le explica que tiene la presión bajita o el pulso rápido, puede ser un síntoma de, además, una complicación. Entonces, el reporte del paciente de los síntomas o de los signos al doctor son como dolor en el abdomen, que en el caso puede ser cualquier cosa en la región abdominal. En la parte B, que es la presentación, el paciente le dice al doctor o le presenta los síntomas con causas cuando visitan al doctor. Entonces también se dicen que esto pueden presentarlo en el momento y lo llaman la presentación de síntomas o presentación del dolor. Se le puede decir presentación de los síntomas o presentación del dolor, por ejemplo, en el abdomen. O ella está presentando un dolor con molestia en el abdomen. O usualmente presenta dolores en el abdomen. Entonces, en la parte C, hablar sobre los síntomas, está la fatiga. Se puede decir que se siente mal, que no se siente completamente bien, que se siente completamente deteriorado o que se siente completamente exhausto en el día. Puede ser también otro síntoma la anorexia, que es falta de apetito, que el apetito es muy malo o que no ha comido por días. La constipación con evacuaciones infrecuentes por motivos de dolor o por la misma constipación en los días o por la irregularidad yendo al baño. Ahora sí, capítulo 15. La sangre. Full blood count. In the investigation of blood disease, the sample test is a full blood count. A full blood count measures the volume in a sample of blood, the amount of hemoglobin, the number of the different cells, red blood cells, que son los eritrocitos, white blood cells, que son los leucocitos, y las plaquetas, que son los trombocitos. The volume of the cells, que es el volumen de las células. The erythrocyte sedimentation rates, measured mean of how quickly red blood cells fall to the bottom of a sample of blood. Anemia. Anemia is one of the common disease of the blood. It may be due to bleeding, loss of blood, excessive destruction of red cells, low production, for example, because the diet is lacking or deficient in iron. A medical student has examined an elderly patients with a very low level of hemoglobin and discusses the case with her professor. What's the most likely diagnosis in this case? Student. Most probably carcinoma of the bowel with chronic blood loss. Professor. What again that as a diagnosis? Student. Well, she Will he has that any change in his bowel habit or lost weighting? Professor, what else would you include in the different diagnosis of severe anemia in a man of this age? Student, he may have leukemia of some sort or aplastic anemia, but that rate it will be very usual. Another case is iron deficiencies, but he seems to have an adequate diet. Professor, okay. Now here, another case of anemia which I think is more likely. Student, chronic bleeding ulcer. Professor, yes, that's right. But what about pernicious anemia? Can you exclude that? Student, well, she got none of the typical neurological symptoms like paresthesia, pernicious anemia. Jordi Pons. Jordi Pons, the medical student from Barcelona, has made some language note in this textbook. Pernicious anemia is condition in which there is atrophy of the gastric mucosa with consequent failure of intrinsic factor production and vitamin B22 malabsorptions. The onset is insidious with progressive increased symptoms of anemia. Patients are sometimes said to have a lemon yellow colors owing to a combination of pallor and mean jaundice caused by excessive breakdown of hemoglobin because of infected red cells production in the bone marrow. A red sore toe is something patient present with symmetrical paresthesia in the fingers and toe, early loss of vibration sense and progressive weakness and ataxia. The spleen may be purple. Chapter 26. Chapter bone. A bone. Some common English name for bones: skull, cranium, jawbone, mandible, spine, vertebral column, breast bone, sternum, rib, costa, collarbone, clavicle, shoulder blade, scapula, thighs bone, femur, kneecap, patella, cheekbone, tibia. B. Fracture. A fracture is a break in a bone. Some of the different types of fracture. Green stick displays community impacted open contour. A pathological fracture is fracture in a diseased bone. A fatigue or stress fracture is due to repair minor trauma, for example, long distance marching or running. Treatment of fractures: when the fragments of a broken bone heal and join together, the unit may be promoted or helped be reduced. The fracture replacing the fragment in their anatomical position if they are displaced. After reduction, excessive movement of the broken bone is prevented by fixation, either external, for example, a simple plaster of breathing cast, or internal, for example, a pain or plate and screen. A displaced fracture with is no reduction may result in malignant, incomplete or incorrect union. Shield hole. A. Millstones. Childhood is the period during which a person is a child. It ends with puberty, the onset of sexual maturity. Infant is another word for a young child. Infancy is the period from birth until about 5 years of age. The milestone in a child development and the age at which they usually occur are sitting by 9 months, crying by 12 months, first words by 18 months, walking by months, talking to words sense by 3 years. By 3 years. Common infection disease. Disease common name. Morbidity rubella malaise. Rubella, German malaise. Varicella chickenpox. Infections, parotitis, mumps, pertussis, whooping cold, acute cold, escarlinata, scarlet fever, rheumatic fever, tetanus, lockjaw, poliomyelitis, polio, celiac disease. A medical student has made some language notes while reading her textbooks. Sensitive to having a negative reaction to waiting, changing the diet from milk only to soul food. Clinical fractures. The symptoms are signs of a disease. Malabsorptions, poor absorptions, malnutrition, poor diet nutrition. 3. Grow strongly. Distension, swelling. The layer that expired. Fuller, when something that's expired do not happen. Stature, size, especially height. The endocrine system. A. Excess and deficiency. An excess too much or a deficiency too little of circulatory hormones causes a wide range of medical conditions, for example, hyperthyroidism and hypothyroidism, where there is an excess of hormone. One form of treatment consists of giving the patients something which inhibits the production of that hormone, as in the use of carbimazole to treat hyperthyroidism. When a hormone is deficient, treatment by B replacement therapy, for example, injections of insulin in the treatment of type 1 diabetes. Doctors say sufferers of type 1 diabetes are deficient in insulin. Negative feedback system. TRH is secreted in the hypothalamus and triggering the production of TSH in the pituitary. TSH stimulates the TSH receptor in the thyroid to increase synthesis of both T4 and T3, and also to release stored hormone produce increased plasma levels of T4 and T3. T3 feeds back on the pituitary and perhaps the hypothalamus to inhibit TRH and TSH secretions. Goiter. An elated thyroid gland is called a goiter. The enlargement may be diffuse, involving most of the gland, or localized, limited to a particular area. Is a solitary nodules. They increased blood flow in diffuse enlargement, for example in Graves' disease, might give rise to a palpable tear, vibrations felt with the head, and audible roar, nose, heart drum, a stethoscope over the gland. A letter of referral. Mr. Davis' doctor has referred her to an endocrinologist. Overactive, more active than is usual, palpitations, awareness of repeat or irregular heartburn, heat intravenous, inability to cope with high temperature, thin tremor, varices, involuntary movements. The age. Part of the age. Alien, iris, purple, eyelashes, a brown. Examination of the age. Where is extracted from the textbook description of who to examine the age. Look for squid, grouping of the upper limb, or oscillation of the age in the leg. The upper eight limb move irregularly instead of smoothly when the patient is asked to look down. Next, examining the purple and note whether they are equal in size, they are irregular in outline, they are abnormally dilated or constricted, they react normally to light and accommodations. To test the reaction to accommodation, ask the patients to look into the distance, hold your finger in front of their nose, and ask the patient to look at it. The edge should come together or converge, and the pupil should constrict as the patients look at the finger. Check also for cataract, retinopathy. Hypertensive change in the retina can be classified from grades 1 to 4. Grade 1, silver weighting of the artery only. Grade 2, grade 1 plus arteriovenous nipping. Grade 3, grade 2 plus flame-shaped hemorrhages and controllable exudates. Grade 4, grade 3 plus lymphedema. The gastrointestinal system, the examiner of the abdomen. Here is an extract from the textbook. Description of the WHO examiner of abdomen. Note if the abdomen are disturbed by fluid or gas. The presence of fluid can be confirmed by demonstrating sheath dullness, percus, or tap first, while the patient's leading supine flat or their back. They ask the patient to lean one side and percus again. If fluid is present, they do note here. On percussion's move, palpate edge regions, feeling to tenderness, pain when touched or messes. Palpable enlargement of tissues. Note also any wearing on rigidity shown by contractions of the abdominal muscle. Wearing may be due to tenderness or anxiety and can be reduced if the patient is forced to relax. Breathing homeward is constricted. B. The faces. There are several words for the faces. Dr. Something says there was blood in the stools. Patient Something says my motions have been very loose lately. Have you faces black stools? Bowel movements is used to refer to defecation. Have your bowels moved today? Have you had a bowel movements today? Bowel habits is a medical expression meaning the practice of defecation. Have you noticed any change of bowel habit? How often do you open your bowel? Are you going to the toilet more often than normal? Change in bowel habit could be constipation, hair, infrequent stools, or diarrhea. Frequent soft or liquid stools. Normal stools are brown in color and semi-solid or foamed. They consistence or degree of hardness and softness can be shown on a scale. The color can vary from black due to altered blood as in melanoma to yellow, gray, or even white. Melena stools are often described as cherry, like the black stick substance that is used in road making. The stools may be red when fresh blood is present, blood that can only be detected with special tests in kiled, fecal, or cool blood. When there is a high fat content, the stools are pale and are sometimes described a clay color. Stools that are large in volume are described as bulky. A bad smell is described as foul or offensive. Menstruator. No. Gynecology. The female reproduction system. Womb, fallopian tubes, ovary, neck of womb, vagina. Menstruations. A period is the common name for a menstrual monthly period. The onset of menstruation is known as menarche. The last menstrual period is commonly abbreviated in doctor's note LMP2. 52 ago means the last menstrual period has 2 weekends ago. The menstrual cycle or length and frequency of period is usually reading in the from 4 28, which means lasting 4 days and occurring every 29 days. If a period lasts more than 4 or 5 days, it can be described as prolonged. The term heavy period means excessive blood loss. Menorrhagia, often white patches of clotted, coagular blood. The term period pains means dysmenorrhea or painful menstruations. A gynecological consultations. A gynecologist is talking to a 30-year-old woman. Gynecologist. Are you period regular? Patients. Yes. Gynecology. How often do you have pains? Patients. Every 4 weekends. Gynecology. How old were you when you started to have pains? Patients. About 20. How long do the periods last usually? A week ago. How you say they are like or even 4 or 5 days. Do you have class light? Do you have period pains? No. Is there any discharge between the periods? Not really. What color it is? I like white. Contractions. For women's methods to prevent pregnancies include the oral contraceptive pills, the diaphragm, and an intrauterine deep EUD or copper coil condoms are available for both men and women. The hair and circulations. 1. Shortness. Shortness of breath. Shortness of breath or breathlessness is dysphonia. At first, this is caused by exertions, physical activity such as clean straining, but in severe cases it may be present even at rest. A patient who is breathless when lying flat, for example in bed, will tend to sleep raises up 1, 2 or more pillows. Here writes the normal resting heart rate is breath per minute. In alerts it may be as low as 14 beats per minute. In extreme athletic activity, the heart rate can go as high. The heart may be regular or irregular. In irregular rates, there might be early beats which interrupt the irregular rhythms, or the rates may vary with respiration, or it may be completely irregular, as in fibrillations. When patients are aware of irregularity, they describe the symptoms of palpitations. Heart failure. Heart failure occurs when the heart is unable to maintain sufficient cardiac output. The amount of blood pumped by the heart each minute for the body needs may involve the left side of the heart, the right side, or both. In left heart failure, the main symptoms is breathlessness. The symptoms of right heart failure include peripheral edema, begin in the feet and ankle. This is known as beating edema if when a finger is pushed into the swelling in case of small dispersions or pain. The heart and circulations through physical examinations. Medical examinations is normal carry out is for stage inspections, palpitations, percussions, and auscultations. Examine the heart and circulations. Here is a extract from a textbook description of how to examine the cardiovascular system. Look at the lips, toe, and nails for the blue discolorations of cyanosis. Cyanosis may be central or peripheral. Inspect the hands for clubbing. Feel the radial pulse at the wrist and note the rate. And beats regular or irregular. The pulse may be irregular in force as well as time. Check that the other peripheral pulse are present. Measure the blood pressures and aces the jugular venous pressures, palpitate the chest from the apex beat. The normal positions is the feet left intercostal space on centimeter medial to the midclavicle line. Feel for any tears. Her size may be measured by percussions. Listen for numbers and other abnormal sounds. For example, frictions fruits begin at the mitral area. Numbers may be short or long. A heart's numbers is long and broad. Note the time of any month in relation to the cardiac circle. The most common numbers are mean systolic, pen systolic, early diastolic, mean diastolic, late diastolic. Continue be listening at the tricuspid, aortic, and pulmonary area.